What we're going to do now is having heard the Minister and having heard the NHS perspectives from Rob Webster, we're now going to get a local government perspective. We've got two senior officers from local authorities running adult social services departments, Ray James and Harold Bodmer, who are going to give us, if you like, town and country perspectives. And we also have, at the same time, I think really good news that we have both the President and the next President of ADASS on the table as a result of that. And we have Councillor Gillian Ford, who's Deputy Chair of the LGA, who's going to be talking to us as well from that perspective. What we're going to have is some very short presentation, short and sharp, from the speakers. What we want then is a discussion, not just questions, although by all means ask questions. I'll be taking 2 or 3 people at a time, and we want to turn this into a bit of back and forth between yourselves and our 3 contributors. We've already heard about issues around commissioning, how that works out in practice for yourselves, contributions and participation in Better Care Fund, resilience planning, the impact of the national living wage and whether that will be passported in terms of its costs through to you. And something that Ray James was saying at the NCAS conference last week, which I think is a really important shared message across the system, is the need to make a compelling economic case for investment in social care. The fact that this sector is worth £43 billion to the economy, it's a huge employer and will be an even bigger employer in the future. And that its reach and impact is not just in the daily lives of the people it cares for, its reaches into the wider economy is significant as well. And that possibly is not always as well understood by the Treasury and others who make decisions about funding. So lots to talk about, and I'm now going to hand over to our panel. I'm going to, I think, start with Ray James, who's going to contribute first.
Okay, good morning everyone. My name is Ray James. The day job is the Director of Health, Housing and Adult Social Care at Enfield Council in North London, so I guess I'm the townie for those of you that were wondering. And this year I have the privilege of being the President of ADASS. So I just wanted to kind of make 3 opening remarks to sort of set the scene. The first of which is to acknowledge that I think we face profound challenges about the sustainability of the sector. There will be lots of times where commissioners and providers don't necessarily agree with each other, but what we've tried to do in ADASS in the run-up to the spending review is to make sure that everybody across the sector speaks with one voice about the challenges that we share, so that we don't get, as it were, played off against each other between commissioners and providers, that we speak to government with one voice. And my thanks to the UKHCA and other provider associations for being willing to do that with us. The second message that I just want to plainly take on the chin is we don't always get it right. I can't sit here and advocate that the commissioning practices of every local authority in the country is as they should be, but equally I probably won't take it that every provider deserves a place at the right hand of the angels as well. So if we can just have some maturity in those sort of conversations, and the phrase that I tend to use is that we are willing to be open book and as transparent as we can be with each other. And one of the things, and I was being reminded that my own authority doesn't always get this right, one of the things I often say to other commissioners is we should be willing to invite providers into the conversation earlier, because quite often you will bring a level of expertise, insight and understanding into the challenges around ensuring that we've got sustainable local social care provision, local home care provision, that someone who sits behind a desk writing out specifications simply will never possess. So hopefully I will try and do my part in extolling my peers to involve in more of those earlier conversations with you. And then the final thought that I wanted to just say at the outset was about workforce. I've been going around the country trying to remind people that every minute of every day, frontline social care staff make a very real difference to the lives of over 1 million people in our country. They deserve to be valued, to be trained and to be paid in a way that's consistent with the quality of service that society rightly expects of them. The announcement on the living wage was really welcome. Who doesn't think that frontline social care staff, frontline home care staff deserve to be paid at least £9 an hour given what we ask of them? It needs to be funded, and it needs to be kind of transparently funded by the spending review, and then I think there's a challenge for us in local authorities, and I talk about this golden thread. If there was some openness and transparency from the Chancellor about what's in the spending review, about funding the true cost of the living wage being passed to local authorities, who after all commission about 70% of frontline care services, very different up and down the country, there should be similar transparency from local authorities about how much of that actually ends up in the pay packets of people working in the system. But we need it to be modelled in the beginning from the Treasury, so that we can then hopefully play our part all the way through. Final thought, just a reminder, many of you will know this is not a homogenous market. There are some parts where the money's the biggest issue. So hearing some of my peers say only last week that actually workforce availability and workforce supply is an even bigger challenge than the money in some parts of the country. So not a homogenous market, but hopefully what we do share is a desire to make sure we make a meaningful difference to the quality of people's lives, and that we use what money is available as best as we both possibly can to that end. Thanks, Paul.
Thank you very much, Ray. Gillian, would you like to go next?
Yes, thank you. I feel like I need a booster seat sitting next to you. Okay, I'm Gillian Ford from the LGA, and I represent on the Community Health and Wellbeing Board. My borough is the London Borough of Havering, and my actual ward has the oldest population out of all London boroughs, so I'm aware of what care needs are. So from the LGA's perspective, the Care Act, as you know, has been in place and making for a number of years, and the LGA has championed reform every step of the way. And across the sector, the principles of what were needed supporting the system, looking and have been long agreed, the focus on personalisation, wellbeing and prevention, national assessments, joined up services, better support for carers, and the centrality of quality and dignity. And a thriving, diverse, and most importantly, sustainable provider market. The aspirations are sound, however, but turning this into reality is extremely difficult, especially in the financial climate that local authorities are finding themselves in. According to the LGA analysis, since 2010, adult social care has had to address a funding gap of 5 billion. They've done this partly by making savings and service reductions within adult social care, but also impacting on other council services. Looking ahead, we estimate that the funding gap in adult social care will grow by at least 700 million a year. This, I stress, is a minimum. It doesn't take into account the full costs associated with the national living wage, so the gap could therefore be much higher. The gap also doesn't take into account other significant pressures that local authorities in the system are experiencing, such as the deprivation of liberty safeguards, increased seasonal demand, and of course the pressures on providers. Despite this context, local government has made great progress in implementing the Act, and at a national level there's been a real partnership approach, as you've heard this morning from the NHS, approach to preparing for implementation. The tripartite national office overseeing preparations and support between the LGA and ADASS and the Department of Health has been extremely helpful part of the government's architecture. This has helped implementation locally, and it's to its council's credit that in the last stocktake survey of council's progress with implementation, which was reviewed back in May 2015, the overwhelming majority of councils, in fact 99%, reported that they were very or fairly confident of delivering the reforms in 2015-16. Cost, of course, remains the big concern. So we're all waiting to see what next month's spending review will deliver. We didn't get any clues today. Shame. Assuming another difficult settlement brings further difficult decisions and changes, we can be assured of one constant, that local government will continue doing all it can to ensure the important reforms of the Care Act are delivered for the benefit of those who have care needs, those who support them with informal caring, and for those who provide vital services.
Thank you very much, Gillian. And finally, can I ask Howard to make his points?
Thank you. So I think I'm here as country mouse, and equally I have the privilege of following Ray as the next president of ADASS. I just want to make 4 very quick points. Let's assume that We've all got the building blocks in place. We've just heard local authorities are confident we can deliver the reforms on the Care Act. The point I'd like to just highlight a few of the key bits. Ray's talked about workforce. I'm not going to make that point. But I would like to talk about prevention, first of all. So in Norfolk, where I am director, our approach to this is to really emphasise prevention. We want Norfolk to be a place where people are helped to stay at home where they possibly can. And if they can and they choose to die at home. And clearly this is a partnership between all of us in the sector. So it's about us working differently with communities and stopping this cliff edge that happens, I think, between voluntary services, which support people often, and community services in their own homes, and then the local authority steps in when an eligibility criteria is tipped and the stuff that's there fades away somehow, and we, between us all, take over. And we need to stop that cliff edge, I think, and have much stronger partnership. So new models of domiciliary care, which we're trying to promote with partners, much more enabling, much more around helping providers of domiciliary care work in partnership with community and voluntary sectors, which takes on to the second point, which is about market development. A very, very different approach to the market is what we need. It is not sustainable, if it ever was, and as Ray says, we're pretty clear, we certainly don't get this right all the time. If it ever was okay for us to sit in darkened rooms coming up with specs and thinking that that was what was going to be delivered, it is not okay now. And this is about us, providers of care, being helped to take responsibility for the whole care arrangements, working as key partners in the care delivery and taking responsibility, I would say, for the management with the person of their whole care, which is, I believe, a personalised approach to that. So very different models of how to do that. And my third point is about asset-based social work and asset-based social care. A move away from the assessment and care management model that we've had for 20 or more years in this country. And that's embedded, I think, in the psyche of a generation of social workers. We've got some fantastic social workers in Norfolk, but I don't underestimate the challenge of moving our practice from one model to another. And I think that requires leadership across the sector. That isn't something that we can do between us, because we're all going to be involved in helping to talk about people's assets rather than their deficits, a different model of doing that, which I think is so important. So finally, I think we've got this wonderful, radical change in social care legislation, the most radical change since 1948. Let's not lose it by allowing the money to get in the way, frankly, and see us as local authorities retrenching into old habits of operating as we try and control the money, but seeing the market work in a different way too. So in a sense, what I'm asking, really, what I'm pleading for, is a partnership here to make this happen. Thank you.
Right, well, can we thank our panel for the contributions in the usual way? So now the aim is to try and move into a bit of a discussion. I'm very keen to get people's comments as well as questions. We've heard contributions about the need for greater transparency from Ray, or open book accounting, but that needs to be modelled right from the top, from the Treasury down. We'll see whether that happens before hell freezes over, but nonetheless an important challenge, I think. We've heard quite a bit about workforce. I think it'd be useful to get perspectives in the room about the workforce challenge in terms of how it's feeling out there on the ground. And there's some stuff about the fact that we're not talking about one marketplace here. It's not the same everywhere, although there probably are common themes that will come out today. So it'd be interesting to get some sort of sense from the room about that. And then new models. I touched upon it briefly earlier, and Harold's just talked a lot about new models that might involve a different way of working, taking more responsibility for the whole set of arrangements for the individual, working to outcomes rather than to task and finish approaches, those sorts of things. So can I see some hands? If you say who you are, where you're from, there's a microphone that's going to be roaming around to facilitate this. Who would like to get the ball rolling? I'm going to take 2 or 3 questions at a time. And it's that, there's a hand, thank you sir for putting your hand up over there. And was there a hand here? No, there's a hand over here, yeah. And there's a hand there, thank you very much sir.
Hi. Is this working? Yeah. Hi, so my name is Gillian Thomas. I'm a consultant for the social care sector, introducing technology. And one of the things I kind of want to throw out to the floor and everybody here is the recruitment crisis that I'm seeing in so many counties of the UK. Ideas, thoughts, what could be done on a national level to help, to support this? I know Wales is doing a lot of work trying to make caring a career. Has that got legs? Is that possible? I just wanted to throw that out there.
Okay, so that's a good challenge about the recruitment crisis that exists in the sector. The announcements, for example, by Lidl and how that might impact as well in terms of people choosing to work in that sector rather than in the care sector. What are the other enablers? And we heard this word from Rob Webster earlier on. That would be very useful to hear. Now, I saw another hand, the gentleman here. Can we get the microphone to him? I'm going to get some comments about enablers that might help to pick up on recruitment in the moment from our panellists.
Thank you. Richard Walker, Chief Exec, Optimo Care Group. I was at an event yesterday, an ADASS event with Lancashire. It was a fantastic event, actually, and it was a round table, commissioner and provider. It's probably the first one I've attended. It wasn't a 100% success, but it was certainly on the right track. It's about engagement, really, and it was the first opportunity to share tables with commissioners from different authorities who I may not be working with, and vice versa. And how can we take that forward? How can ADASS maybe work to roll that into other areas? Because certainly the conversations I was having with Stephen and other people there, there's no joined-up plan to put that around. And it was very useful.
Just take one more if there's any more that would like to contribute at this stage. There's a hand right at the back there.
Kevin Nutt, CareWatch. We heard earlier today about commissioners' behaviours. One of the things we're experiencing considerably across the whole of the UK at the moment is not just the disconnect in terms of discussion between provider and commissioner, but increasingly a lack of joined-up thinking between the commissioning entities, not just the people who write the specs, but the people who procure the process and the brokers who operate it. And in a significant number of large tenders, there has been little joined-up work, so that where you, for instance, in 2 very recent large-scale procurement activities, you have established providers being moved around the county on the whim of a procurement exercise and an evaluation process, which has had the effect of actually significantly damaging the workforce. And the loss of workforce in 2 examples that we've worked with has been about 20% of the carer workforce who will not accept the transition that's going through. So my cry is, if we're looking from the bottom up, what does it take to keep a carer in the sector? And what I would suggest at the moment, it is not large-scale procurement activities which cause staff to be very uncertain about their own futures. It's not just about the pay, it's about where they're going to be and who they're going to be working for.
Okay, thanks very much for that, Kevin. So we've got some challenging points about how commissioning really is intelligence-led, understands the nature of the market and the providers in it and the impact of commissioning choices and procurement decisions. And we've got a piece about how do we sort of replicate the sort of round table approach that Lancashire has adopted. Is that something which ADASS is encouraging? It would be interesting, Ray, to hear about that. And then possibly it would be useful to get some feedback from all 3 of you about enablers to getting more people to both stay in this workforce but also come into this workforce at the moment in particular. I hear a lot about not enough young people coming through. Are there more things that can be done in that regard? So I'll start with Ray, maybe to pick up on all 3 of those, and then I'll come to the other contributors.
Okay, so in the order that they kind of came through, so Geraint, I think it's a crucial question, and ultimately I think the experience of people receiving care will be determined more by the behaviours of the people who have the privilege of visiting them in their homes than anything else. So not just getting the right volume, but getting the right quality of people with the right behaviours and the right skills is going to be central. And if we look at the demography of the current workforce, we know what it looks like. It's predominantly female and it's predominantly older. And if we look at the demography of the numbers of people who are going to need services, we think we're probably going to need 700,000 to 800,000 more people working in social care in a decade's time than the 1.5 million who are doing it today. So I think it does need some sort of concerted effort around this at a national level, and we are having some discussions of that nature, Skills for Care, Health Education England. But I think replicating just advertising better the current job roles won't do it, because people have voted with their feet. So I do think we need to try and develop kind of career options and other things. So for example, is there a role at some sort of scale that is something between the frontline domiciliary care worker of today and the district nurse? Which might provide an opportunity for a more skilled workforce, for progression, for a different order of training, and actually might help us with the sustainability of the sector and the overall kind of cost usage would be one idea in there. We do generally find that when people with the right motivation come to work in the sector, it can be very rewarding. I mean, it can be usually challenging, but it can also be very rewarding. And sometimes it will be the voices of people who work in the sector that we need to create the opportunity for others to hear. Because if I go around saying it, well, I kind of would say it, wouldn't I? I remember we had an ambassador scheme a few years ago, and I thought, that's great, I'll go around and tell people how great social care is. I got told, sit down, Ray, you've got no currency with young people, you're just too old. Let some people who actually do the job go around and do it. So create opportunities for other people's voices to be heard on that one. Richard, on the engagement piece, yes, absolutely, and we are trying to encourage more of that. We've developed a kind of a toolkit, Commissioning for Better Outcomes, which is much more outcomes focused, and it's involving a range of providers in that. It also has the potential for peer reviews, and we've involved peer reviews, and thanks to the UKHCA who've been involved in some of those peer review teams to kind of go in and hold a mirror up to local authorities about their practice and make suggestions for improvement as well. If providers enter those rooms with the right sort of constructive, collaborative behaviours that you would expect of the commissioners, more of it will happen. If providers enter those rooms thinking, great, this is my best chance to give them a kick-in, less of it will happen. So I know that's not what you would do, but you'll understand that the way that you enter into those conversations will help to influence more. So thank you for encouraging it. And then finally, the question, Kevin, about the different entities all, yeah, I just kind of recognised it, sadly, was my reaction to that. I talk about us, the job as commissioners now is not to effect transactions ourselves very often, it's to create the conditions within which local people can make an informed choice about the quality of care that they want to spend their money on. Now that might be people who are spending a personal budget that is given to them by the state, or it might be people who are choosing to spend their own means in relation to that. So the more we can do to create the conditions within which they do that. Now we have some difficulty here because if we do that completely, some providers will say there's too much risk for me, that doesn't give me enough certainty, that will have an impact on price and other things. Relative to the issue that we place about choice as well. And we also have an issue in relation to how do we get the balance right between not embarking on those procurement exercises that you describe, but not allowing a status quo where the quality isn't good enough to pervade either. So I always talk about transparency. So the more we are able to share what is a meaningful thing that you or I might use to guide us if we were making a purchasing decision for the care and support of somebody that we love, in a transparent way available to the local population, underpinned by trying to be open book about what's a fair and true price for sustainable care, that gives us the best chance. but it's not easy, and it requires collaboration between us in order to try and help people make that informed choice.
Before I bring in Gillian, just one little challenge back, if I may, on that. One of the things I often hear from people in the provider community is that they hear those sorts of very worthwhile comments being made about collaboration, transparency from the top of organisations, but the people they're engaging with on a day-to-day basis, the procurement officers, the people who are involved in the brokerage and so on, and they either are behaving in a constrained way or not in a collaborative way. How does that sort of leadership that you've been talking about change the behaviours down in the organisation so that there is that practice as well?
So it's a completely fair challenge, Paul, and I've had the challenge made to me by some very well-respected providers on my own local patch as well, where they've not experienced staff in my own organisation, behaving in a way that's entirely consistent with that. So one, I think you're right to keep challenging us. We will also, and this is probably a role with the elected politicians as well, so one of the things we've tried to do is to share in an open book way with our elected members what the true cost of care and the provision of care will be, so that when they come to difficult financial budget decisions, they've had some insight in that as well. Ultimately, when you've had 31% real terms reduction in the adult social care budgets over the last 5 years, it is difficult, and some people will end up therefore being very, very focused on price. Hopefully we will continue, if people keep expressing the issues, we will try and get that balance between quality and price right. And if we go too far one way, you need to pull us up on it. And we need to have an open conversation.
Now, I'm going to come to the other panelists in a second, but I wanted to make sure we get some more comments from the room, if that's okay. I've seen a hand over here. Can I just see if there are any other hands, people who want to contribute? So we'll take that comment first, and then I'll come back to Harold and Gillian.
Thank you. I'd just like to reiterate the specialism part of working, which I quite agree with. I think it's excellent. And I think there's a role for health and wellbeing boards to play on this one, because not only are, for example, if we were to train our personal care assistants to put eye drops in, ear drops, the work that is normally carried out by the district nurse, that's a saving in itself, because it means that the district nurses don't need to go there. But we need to come, I think we need to think about, you know me, I'm Greek, and I always want something for nothing. So training, it's a give and take, isn't it? Because we're saving them money, and they'll be helping us, supporting us to train our workforce to specialise specifically. By the way, my name's Litsa Warren. I'm the Chief CEO for Alpha Care Specialists.
This gentleman with the hand up here, then I'll come back to the panel.
Rob Grady from Eclipse Homecare. Just a point following on from the specialism. One of the problems we have, of course, is being able to sufficiently differentiate into pay terms for people who have more skills. So as we move in that sort of direction, one of the problems is that our better staff get picked off and actually move across into other parts of the health and social care economy, because we're just not able to compete on pay.
Right, I'm going to go back to the panel, and I'm just going to ask Harold and Gillian to pick up on those 2 points, and briefly, because I've been a bad chair and we're running over on time. So there we go. Harold.
So I absolutely agree with you about specialisms. I think I missed the session from Rob Webster this morning, but I think one of the issues sometimes about our NHS partners is they don't recognise always that social care is not delivered by local authorities, but actually is delivered by home care assistants out there in the community. So I think we've got to have a very different partnership around this, and that would encourage just that, a different approach to work. There is a risk, of course there's a risk around this, which is why I think, hopefully the National Living Wage will help with this, but why I think that we really ought to be focusing health commissioning into this differently. So it's not just seen as something that's done by the local authority. And if I could just make one other really quick point about how we can promote the workforce more generally, or promote social care as a career more generally. I wonder whether we're doing enough between us all at working with the colleges. So in Norfolk, Norfolk City College trains loads of young people in health and social care, and I'm not sure what happens to them. I need to find out, of course, but I'm not quite sure where they all are, really. And we're not, somehow between us all, we're not capturing those young people and getting them into your organisations.
And then Gillian.
I was going to come in on the workforce, that the LGA are very sincere in looking at the issues there are on workforce. In fact, that's one of our work streams that we're going to be identifying in greater detail. You pinched my line on colleges and universities as well. What engagement are we having with those? It's that not sexy pathway. It's something that our youngsters were not encouraging as a career. So we don't have that progression model in place. How are we going to change and deliver that? Unfortunately, I can't comment on the differentiated scales. That would be down to my colleagues to be able to deal with that. And with the delivering of services, eye drops, etc., we're looking at skills and training jointly with NHS and local authorities, etc., so there can be some shared experiences and how they can be delivered. For example, pharmacies as well, they can be delivering things that GPs don't need to be delivering. So it's how we can do things differently. And that's all I can say really on the subject.
No, thank you very much, Gillian. And so we've had some useful feedback about workforce. I think the thing I would just conclude on this session is you've heard some invitations about collaboration and transparency from Ray and from Harold and from Gillian. I would take and play some of that back to your own local authorities and then feed it back to ADASS if the answers you get don't quite match the ones you've heard here today.